Lupus, a foreign word yet a concept so close to home, predominantly a female disease with 90% of patients globally being female. Imagine a war where soldiers are fighting against their team members. With lupus, your immune system attacks tissues in your own body. Normally, when foreign invaders get in your body, the white blood cells identify them as foreign since they contain antibodies. With lupus, the white blood cells mistakenly mark antibodies against your own cells as foreign and hence attack them as though they were antigens. Over time, the autoimmune reaction causes inflammation during the attack, in turn making the blood vessels in the area expand and begin swelling. This was all a foreign concept for Sally before she was correctly diagnosed.
I'd treat a rash one time, or a headache, or difficulty in breathing, swelling joints and fingertips, diarrhea, you name them all. So at that particular time, I would get different medication, not necessarily lupus medication. And yeah, then I was recommended a general doctor at Colombia, Africa on 2nd Parklands Avenue. So when I scheduled for an appointment, when I just walked in, he could tell what I was suffering from. And he told me, Sally, I know what you're suffering from, but we'll have to dig in more just to confirm my theory. So I told him my medical history and everything because I didn't have exact meds. So we were just doing herbal medicine mostly, alternative medicine. And so, you know, African homes, prayer is paramount. So after me telling him the medical history, he did an examination on me, and he told me I have the butterfly rash. It's usually around your cheeks and your nose bridge, and that is one of the telltales of lupus. Also, Raynaud's syndrome, your fingertips and your toes get really cold. You can literally touch the gas. So they get cold, then with time they go back to normal.
There are four types of lupus. Systemic lupus erythematosus, the most common form of lupus. Cutaneous lupus, this one is limited to skin. Drug-induced lupus, a lupus kind disease caused by certain prescription drugs. And neonatal lupus, a rare condition that affects infants of women who have lupus.
So after the appointment, I did a few tests done, and I tested positive for Sjogren syndrome, systemic lupus erythematosus.
Those suffering from this disease eventually get a lot of complications like infection. People with lupus are more vulnerable to infection because both the disease and its treatments can weaken the immune system. Having lupus also appears to increase your risk of cancer. However, the risk is minimal according to medics. Women with lupus have an increased risk of miscarriage, lupus increasing the risk of high blood pressure during pregnancy and preterm birth. Living with lupus has not been a smooth ride for Sally.
I lost a lot of weight. I weighed around 70 kgs. Now I am at 44. And I've been at 44 kgs since last year. So you can imagine the pressure of wanting to gain weight. Because when you go to hospitals, there are stairs. And sometimes when they'd ask me of my HIV status, and I'd tell them I am aware, I am negative, they wouldn't believe. They would want to perform a test. And also because lupus has affected my lungs and kidneys, I used to get treated for TB. I get tests done, which is also another cost, and yet I don't have TB. So yeah, there's also that. The medical industry, or rather the health system, doesn't really know about these diseases. So it's just a hit and miss. It took a toll on my mom because we've been with her since day one. So it took a toll on her. Even though she doesn't show it, but you can tell. My brother he doesn't know what is going on. He just says, yeah, he's figuring it out too. So he has had to grow up faster for me, because when mom is not around, he's the one doing most of the things here. My sister, she doesn't really know. She's sympathetic like everyone else. My father refuses to accept. He insists it's something else. Even after meeting my doctors for a number of times, he hasn't accepted it yet. Yeah.
Though there is no known cure for lupus, early diagnosis and treatment can keep the disease under control, according to medical experts. David Kagina, Switch TV.